if you see, the age is the most important factor. Hormonal imbalance, age, ethnicity, obesity, habits, these are multiple factors. Even there are causes which are unknown. Breast cancer is very easy to detect. If you see the clinical breast examination by the clinician, and the mammography, there are 3 simple ways to detect the lump in the breast or the lump in the armpit. With this, we can detect the breast cancer at very early stage. Breast cancer is considered as a systemic disease. What do you mean by systemic? That it can come from the breast, but it can spread to other parts of the body. So it requires the multidisciplinary treatment, that is surgery, chemotherapy and radiation. Surgery means either we remove the part of the breast, that is called breast conservation surgery, or complete removal of the breast, that is called mastectomy. Based on the tumor size or the lump size, we can decide whether we can do breast conservation or we can do complete removal of the breast. People think that if we conserve the breast, the disease will come back. But just to make you notice that if we take the radiation properly after doing the breast conservation, the chances of recurrences in the mastectomy and the breast conservation are the same. Chemotherapy means we give the injections to control the disease spread, microscopic disease somewhere else in the body. And the radiation means the use of X-rays to kill the cancer cells which are microscopically present in the tumor bed, so which reduces the local recurrence rate. So surgery and radiation is a local treatment, and chemotherapy and hormonal therapy is a systemic treatment. So with this help of multi-system treatment, even at stage 3, breast cancer is curable. So that if we do proper clinical examination, mammography, we can detect it early and we can definitely have a good cure rate. These breast patients not only survive for longer time, but they survive with a good quality of life. Thank you.
Breast cancer is most common in women. In India, there will be more than 2.38 lakh new cases of breast cancer by 2025. Means every 3 minutes, a woman is diagnosed with breast cancer. Early detection leads to higher survival, so take action. This October, which is Breast Cancer Awareness Month, explore yourself to foresee the risk and conquer breast cancer. This is a self-awareness guide. Few risk factors include family predisposition, age, race, reproductive and menstrual history, overweight, smoking, excessive alcohol, high-fat diet, gender, genetics. Breast density means having dense breasts. Regular screening can detect breast cancer at an earlier stage when it is most treatable. If you are in between age 20 to 40 years, you should do a clinical breast examination once every 3 years. Clinical breast examination means physical examination done by doctor as part of regular medical checkup. If you are of age more than 40 years, you should do a screening mammogram once in a year. Screening mammogram is an X-ray of breast to detect breast cancer in women who do not have apparent symptoms. So, what can you do to reduce the risk? Don't smoke. Control your weight. Breastfeed if possible. Be physically active. Limit alcohol drinking. Limit dose and duration of hormone therapy. Avoid exposure to radiation or pollution. And in nutrition, eat 5 or more servings of fruit and vegetables daily. The most preferred treatments of breast cancer include surgery, radiotherapy, chemotherapy, hormonal therapy, targeted therapy. Self-examination is important, but what to look for? Any change in breast size, redness or patches on the skin, discharge from your nipple, an inverted nipple, dimpled skin or orange peel-like texture, any swellings under your armpit or on your collarbone, lumps or thickening of the skin, pain from your breast or armpit. How to examine breasts yourself? Stretch up your arms and look for any differences in the shape or contour of your breasts. You might want to wet your skin to make the examination more easier. Start from the nipple. Move the pads of your fingers in increasing circles until you reach the edge of your breast. Do this for each breast. Then run the pads of your fingers up and down as shown in the diagram from the collarbone down to your breastbone, both on your left and right side. Then lie down. Move the pads of your fingers in the circular movements again and also run the fingertips up and down from your collarbone to your armpit and down past your cleavage to your breastbone. Do this on both sides of your body. You must be sure to feel all the tissue of the breast from the soft front of the breast to the tissue beneath. Use light pressure to feel the top of the breast, then a medium pressure to feel deeper into the breast. Use a firmer pressure to feel down to the rib cage. Now, you should concentrate on the lymph nodes that run up into the neck, around the collarbone, and down under your armpit and lower to your side. Do not just think that it is only your actual breasts that need attention. Do this on both sides of your body. Any abnormality, if you think, needs to be consulted with a doctor. Kindly consult your doctor for further information. Issued in public interest by Lupin Oncology.